So, Don, really all credit goes to you for the name of this program, WIHI. This is the one you came up with a while ago, and we stuck with it. What were you thinking when you said WIHI, and what does it mean to you?
We have to find a way to get information, knowledge, motivation, sharing out as far and as fast as we can at the minimum possible cost and lowest possible level of carbon in the atmosphere. I can't think of any metaphor better than broadcast. I think I want WIHI to become kind of open source of enormous amounts of information for people who want to study and learn and progress improvement with us.
We've designed WIHI to offer a leading lens on the latest innovations with improvement in patient safety and to make much stronger connections than we have before to their policy and healthcare reform implications. So we really are trying to connect to this larger engine that's going on in the country. Why is that not only timely but really important?
I think in social change terms, the country's unfrozen. It is an enormous carnival of thinking and dialogue and debate and policy initiatives underway. It's happening in states and now, of course, even more in Washington. And just keeping tabs of this is almost impossible. I think I hope WIHI will be a place where we can help tell the story, bring in people that are involved in the fray, both as consumers of policy and people making policy, and elevate the conversation about what a rational policy environment would look like. Even while we continue to use WIHI to push out technical knowledge, still, how do you control pain? How do you manage flow in a hospital? How can you engage physicians more effectively? We'll be working all the way from the policy arena down to the shop floor.
One of my hopes is that we're able to bring more people into this conversation to enlarge the stakeholder group, all those who feel passionate about improving the system, and to pull people out of their usual comfort zones and silos. We might even have some debate, for God's sakes. So, is that important to you as well?
Yeah, nobody knows the answers right now. This is a time for lots of dialogue and open consideration and some fireworks around just what should happen. Nobody has the answers right now. So why don't we create a platform for open conversation? I'll be part of it, and we'll welcome influentials and participants from all levels to just get involved and talk. I think, we'll find the right way through this, but we should do it in open air.
People are extremely busy. You among them,
yeah.
And many of the people who are watching or listening to you have very, very full plates, especially this year with the economy, no less a full plate talking about improvement. What's the best argument you can make for making time for WIHI, either to join it live or to download it and listen to it at another time?
If you want to be an involved and informed citizen, you've got to find a way to do it. You can listen to the public airwaves. You can read your newspaper. There's going to be another way, hopefully a really easy way. My daughter says now that every morning she's downloading NPR stories and putting it on her iPod and then walking to her classes at medical school, listening to the podcast. I hope WIHI has the same property, something worth mapping into your day, so you can just stay abreast of what's happening in a really, really complicated arena.